Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
The American Academy of Orthopedic Surgeons estimates 10 million Americans suffer from osteoporosis, a disease that weakens bones, and another 10 million are at risk of fracture because of low bone mass. So is it inevitable? Dr. Rick Placide of OrthoVirginia and Chippenham and Johnston-Willis hospitals is here to talk about it. So first, osteoporosis is considered a silent disease because you can't feel your bones getting weaker, right?
That's correct. You can't feel them getting weaker. Unfortunately, you only feel it when you have a consequence of osteoporosis, which is a fracture or a broken bone.
The interesting thing, too, is we hear this, and a lot of times we hear it associated with women, but can men suffer from it as well?
Well, certainly women, it's much more common, but up to 20% of patients with osteoporosis are male.
Is there anything that we can do? You know, a lot of people think of home remedies or things that you can do at home to kind of head it off.
Well, absolutely. Very simple activities such as weight-bearing exercise, walking, dancing, light weightlifting.
Dancing even?
Dancing, yes, if you can do that. As well as simple vitamins. Vitamin D and calcium are critically important in protecting your bones.
And I know you have a program that is kind of designed to help with all of this, right? Tell us a little about it.
So with Chippenham Johnston-Willis Medical Centers here in Richmond, Virginia, there's a program through the American Orthopedic Association called Own the Bone. And it's a quality improvement program. It's a patient awareness education, community awareness education program, not only to identify patients with fractures, broken bones from osteoporosis, but to then help prevent further fractures.
So the whole idea here is there is things that we can do. There are things that we can do at home to kind of tackle this issue.
Absolutely, and we're starting that here in Richmond.
Right here in Richmond.
Yes.
Anything else that we have not asked you that you think is important for people to keep in mind?
I think that just keeping their ears open for this program. It's just initiating. This is the first program of its kind in Richmond, and be on the lookout.
Dr. Rick Placide, thanks so much for joining us today.
Thank you.